Well, school is starting. It has already started in many parts of the United States. Over in Slidell, Louisiana, for example, the local TV station WDSU reporting it's the parents' worst nightmare. 4 kids, not 1, but 4 kids testing positive for COVID-19. The youngest, 5-month-old Abigail, and 2-year-old Shar are currently still at Children's Hospital in New Orleans, where there are no beds available. Abigail is on an assisted breathing machine. She's 2 years old. They're talking about mom and dad. Mom and dad were both vaccinated, but mom says, my children went from laughing and playing babies to laying around. Every time they moved, they coughed. They couldn't breathe. I cannot wait until my babies are home. And she is praying that all the kids will have a safe school year. This is a real challenge for us. How do we keep our children safe? On the line with us is Jennifer Stefano, Vice President and Chief Strategist at the Commonwealth Foundation, commonwealthfoundation.org, and a fellow with the Independent Women's Forum, IWF.org. You can tweet her at Jennifer Stefano, Stefano, or at Liberty #4 PA, or at IWF. Jennifer, welcome to the program. So what is your plan for protecting our children who can't get vaccinated yet, and for protecting the people that the children come into contact with, like my 91-year-old mother-in-law who wants to hang out with her grandchildren?
Yeah, so first, the thing we have to do as parents is make decisions in our lives about whether we should or shouldn't let our children be exposed to someone who might be vulnerable. And that's a tough decision, Tom. I completely get it. I'm around people who might have high risks, and they said, I'm done living like this, and I want to be around people I love. And so I think that's a personal one-to-one decision that we all have to make in our lives, and it's tough. This is in no way easy because there are...
But that has nothing to do with the schools. I'm asking the question,
No.
how do we protect our children? Well, I added my 91-year-old mother-in-law, but you know, it would be coming from the schools. My understanding is that your position is that we should not mandate masks in schools, and I'm trying to understand that.
Yeah, no, and I appreciate it. I think what we should do is allow local communities and local schools and parents to be involved in making these decisions. And here's why. Because I do like the question of how we should protect our children, but it's not just against COVID. Because as you know, Tom, and as I know, I went and looked at the number of suicides in 2020. Now, while a lot of childhood diseases and other illnesses went down in 2020, the one thing that went up is suicide, suicide attempts, and suicide ideation.
Jennifer, are you trying to tell me that if we ask kids to wear masks in school, they're going to commit suicide?
No,
is that your argument, really?
There are a lot. No, that's not my argument. Let me finish. I want to finish the sentence.
Sure.
I think there are multiple things that we have to think about for the health and well-being of our children, COVID being one of them. And we have vaccines to help that. And then we have, there has been not met, well, there are actually, the CDC has now approved the vaccines for 12 years old and up. So some of our children can be vaccinated if parents choose to allow that. And I think that you have to look at the child holistically. And I think the power belongs in the hands of the parents in the local community. I think Florida has the best solution. The Florida Tax Credit Scholarship Organization said, if you feel you are being COVID harassed, whether it is because your children are not going to a school where they're wearing masks or your children are going to a school where they're mandating masks, we will give you a tax credit scholarship that your children can go to a different school that suits your needs. Because, again, my children
vouchers
have
for
dyslexia.
Private schools? This is your solution, really? So do you think that...
Elizabeth, wait a minute. It's Elizabeth Warren's solution in her book, The Two-Income Trap. I very much applaud her policy prescription to actually give fully subsidized scholarships or vouchers to all children. I
guarantee you, Jennifer, Elizabeth
field.
Warren did not write about COVID in her book, number one.
She 100%
number two,
wrote about vouchers.
Are you suggesting that local communities and local school boards should be deciding whether children should be vaccinated against measles and mumps and other diseases?
Well, actually, this was happening long before. I'll give you an article out of the left-leaning The Atlantic from 2014 that said wealthy suburban counties in L.A. had lower vaccination rates than Sudan. That's not crazy conservatives. They're super wealthy white liberals.
But
There's long been a problem in America.
They're still mandating shots for kids to go into school.
No, Tom, they were. Let me tell you.
Okay, so you're condemning that, Jennifer. You're saying that these children should be vaccinated in the Los Angeles schools. So why shouldn't they be masked in the Florida schools?
I think that you have to put the power where it belongs, into the hands of the local community.
We're talking about public health here, Jennifer. We're not talking about, what you're saying is that if I'm sending my kid to school, that my child's health and my health also, we've got breakthrough infections and things, that our health is dependent on some parent who's sitting around watching lying Republican politicians on Fox News telling them there's nothing to worry about and they should be, running around without a mask. I don't see how that leads to any kind of good public health outcome.
I will again point out that there are many progressives as well that have long eschewed vaccines and other things that would be better for public health. This is really not a left or right issue. What I am saying is when it comes to a child's health and all of our health, I wish COVID were the only threat we were facing to our health, but we are not. And so we have to look at it more holistically, and we have to let communities make the best decisions. And there are children who suffer from mental health issues. My children have learning disabilities. And in terms of being able to succeed in school and other issues, it may or may not be good for them to wear a mask. And there might be parents who absolutely want to go to school where everyone wears a mask. And you know what? We can allow for both if we just give parents choice. Again, I very much support Senator Elizabeth Warren's policy.
This is not Elizabeth Warren's proposal. You want to force public school teachers to be exposed to this disease. I know your organization, the Independent Women's Forum, has a long history of, basically hating on teachers' unions. So expose the teachers, expose the kids in the public schools, and hey, if people don't like that, if parents are afraid of that, we'll give you money that you can give to a private, for-profit, school that, just might be kicking some money back to the Republicans. Am I understanding this correctly?
Tom, our frontline healthcare workers have been dealing with COVID up close and personal in a medical environment for the entire year and a half. Can you tell me what percentage of them died and got sick from it? Because I feel like the teachers are trying to act as though they are under
had over
a greater
2,000
or
dead
dire
doctors.
threat than our first responders. And I think that's
2,000
wildly
dead doctors.
unfair. The fact is this, that no one is asking teachers not to wear masks. They can mask up. They can double mask up. And the teachers union just said that they and pushed back against the CDC to allow teachers that have disabilities or have people in their lives that could be exposed to COVID that they don't have to go in. So I'm sorry, Tom, teachers are well protected and they have every right to not even go in. This is guidelines from the CDC. So I am at a loss for why you think that we should make children mask up.
Extraordinarily disingenuous.
That is extraordinarily the truth. You can go on to the
It's extraordinarily disingenuous, Jennifer. Wearing a mask does not offer you 100% or even anything close to it protection if somebody is blowing virus in your face. The main purpose for the mask is to stop the virus coming out of the mouth of the person who's infected, in this case, the child who's infected. We don't want those children infecting the children around them or their teachers. And that's why everybody needs to wear a mask. What you're suggesting is that swimming pools start having a pee in the pool section over, in 1/3 of the pool, and don't pee in the pool section in the 2/3 of the pool. And that's crazy.
So I'm just going to go on the record that Jennifer Stefano does never endorse peeing in pools. Just please don't do it.
Well, this is what you're suggesting, that kids should be blowing viruses all over a classroom. How is that different?
I again go back and say, I think the power should be in the hands of the parents and the local community to best make this decision.
These are public health decisions. These are life and death public health decisions, Jennifer. When these people get COVID, they go to the hospital. They go to the medical professionals and say, please save my life. 600,000 people are dead because of this disease. And you're saying, oh, we should let parents make medical decisions for our entire community, for our schools, for our kids, for everybody? We have never done that.
Sure we have. We have.
Not when it comes to life and death. We vaccinate for polio. We vaccinate for smallpox. When there's deadly diseases out there, we vaccinate. And we require public health measures.
I will tweet it to you, the 2014 headline in The Atlantic. Many liberals and progressives leading up and prior to COVID refused, because Gwyneth Paltrow over at Goop or whomever told them that vaccines are bad, stopped vaccinating their kids. So I would argue that there is plenty of examples of people not doing what is in the best interest of public health. People still smoke. There's a burgeoning industry, and many people are promoting.
And they're not going to go smoking in a classroom.
May or may not. Okay.
They are not going to be smoking in a classroom.
Clear
and if you can't blow smoke around in a classroom, why should you blow a deadly virus around in a classroom?
Well, I've seen some of the things we teach in American classrooms. I would argue a lot of smoke is being blown in American classrooms these days.
You know, deflecting is
deflecting. I have repeatedly said if you will honestly say that both, regardless of your political point of view, I think everyone who has an opinion on this, both sides, want to see the health and well-being of our children and each other.
But not our schools.
Okay.
You know, I get it that you're on a Jeremiah here to destroy our public schools, and this will, help that. I get that.
Yeah.
But
so again, I think both sides are looking out for the best interests of our children and how to educate them. What I think that we have to do is holistically look at it. There are many public health issues at play aside from COVID. It is not just COVID that threatens us and our health. And I think, the head of the infectious disease for children at Tufts Pediatric came out in the Wall Street Journal and co-authored with a doctor from Johns Hopkins Medical the case against masks for children. Now, that's not to say that alone should dictate public policy, but there is serious scientific debate on this issue. And I think
as of Saturday, we had 1,902 children in the hospitals in the United States with COVID.
I understand that. And what these doctors
and your policies would increase
is that
those
masks
numbers.
May not. Well, actually, these doctors argue that the masks may not impact or help that. And what I'm saying is, as parents look at all the factors that do and do not contribute to their individual child's health and the community at large, they should be empowered to make the best decisions.
Okay.
Why can't we trust our people to make the best decisions?
Because some of them are idiots, and they and their kids shouldn't expose the rest of us.